Greetings from MCV Memorial ENT Trust Hospital, Pollachi. In this presentation, we will be looking at important clinical signs and how they are useful in management of benign intracranial hypertension. The first part of the presentation has a video of the patient, how she presented in the clinic. Now let's take a look. She is a obese, middle-aged woman who had clear watery discharge from the left side of the nose. It had started spontaneously and the duration was about 20 days. Now you can see that the patient is bending down and lying down on the bed in a prone position. This elicits what is called as the Teapot Sign. So you can see that the fluid is almost clear, and unlike the mucoid discharge which you get in rhinitis, this is clear, non-sticky fluid. And the patient had at least 20 drops per minute. A high index of suspicion needs to be maintained, especially in these cases, because most of the time when it is spontaneous, the patient actually interprets it as cold and they often demand investigations and medication according to that. So you need to explain to them what the problem is. So a CT cystogram was ordered for this lady and you can see the findings. It shows a clear defect in the cribriform plate and the defect measures 2 into 2.2 millimeter and there is a clear meningo seal coming out. Another important aspect is diuretics were not started prior to the cystogram because then the leak would become less obvious. And also the other concern is sometimes the cystogram itself, because of the dye that they use, sometimes it causes a degree of inflammation and that also can reduce the leak. So if you want to close it endoscopically, then it becomes difficult to identify the site. Now coming to the signs that have to be looked for in a patient with benign intracranial hypertension. The first thing is when you examine them in the clinic, you have to look for the teapot sign, which I showed in the first part of the video. The second thing is you can do an endoscopy to look for the site of the leak. The other important thing is if beta 2 transferrin testing is available, you can send it for testing. You can collect the CSF and send it. And the other important thing is, especially in these cases where you suspect BIH, you should look for papilledema. So dilate the eyes and look for papilledema with the ophthalmoscope. Now finally the CT cystogram findings. So what are the important signs that you look for? First, you look for an empty cella or a partially empty cella, because the CSF with its high pressure tends to find pathways of least resistance. So one of these pathways is the cella region. So that gets replaced by the CSF and you can see a partially or a totally empty cella. So that is the first sign. The second important thing that you can see is optic nerve tortuosity, perioptic widening, and a certain degree of flattening of the posterior part of the globe, and optic disc edema. And other signs that can be seen in the skull base are widening of the foramina and thinning of the skull base bones, and also flattening and arachnoid pits can be seen. The patient was taken up for endoscopic closure of the defect, and as you can see in the picture, the meningocele is clearly seen. Free end of a Cortles elevator was used to calculate the distance between the axilla of the middle turbinate and the defect area. This corresponded with the findings in the CT cystogram. The distance was the same. And further, the meningocele was cauterized and an underlay autograft was placed in the defect area. To further buttress the same, a pedicle middle terminate flap was taken, medial end of which was further made raw to enhance the fibrosis, and the whole assembly was supported with a vascular clip between the middle terminate mucosa and the septal pocket, which was made medially. Now, in summary, I would like to say that benign intracranial hypertension should be suspected in obese middle-aged women with spontaneous CSF leaks. In addition to surgical closure of the defect, long-term medical treatment should be emphasized in these patients. CT cystogram findings like empty cella, optic nerve tortuosity, perioptic edema should be looked for, and they are very useful signs in predicting benign intracranial hypertension and their course. CSF drop rate is again a very important parameter, and while they are doing the CT cystogram, this parameter can be asked for and is a useful indicator, prognostic indicator. Thank you for listening.